of the very simple things that you can do yourself, or you can help your partner to do. Not that it will identify all forms of cancers in the male reproductive system, but it certainly is something very easy that you can do yourself, is to feel the testicles as well as the spermatic cords behind the testicles. If you feel a hard, craggy or irregular type of lump, if it's particularly painful, if you feel something on the one side that isn't present on the other side, if there is significant swelling in the testicle and it just looks discolored, those are the very simple things that you can do to possibly help you identify a cancer in the male reproductive organ early. And just as there are uterine congenital defects, spermatic duct defects also exist. With this condition, defects in the spermatic duct means that although semen does come out when the man is ejaculating, the semen doesn't contain any sperm cells. And this spermatic duct defect often leads to blockage, meaning that sperm cells do not enter the semen in the first place. Now, onto lifestyle factors. Drug use, in particular, illegal drugs, recreational drugs. Also, guys, anabolic steroids are also considered bad when it comes to sperm count. These recreational drugs, these anabolic steroids, they lead to infertility because they impair the sperm cell function. So you may be producing sperm cells just fine, but actually you end up with a greater percentage of sperm cells with abnormal morphology. The sperm cells do not have a good mobile or good motility. And when you use these type of drugs, you are basically producing poor quality sperm. And in some cases, depending on which type of drugs that you are using, you may actually be impairing the production of sperm cells in the first place, because some of these drugs cause hormonal imbalances. Then we have alcohol use, tobacco smoking. These both lower your testosterone levels and ultimately lead to erectile dysfunction, but they also lead to low sperm count and reduce sperm cells motility. Excessive weight gain, obesity, as well as chronic stress over a long period of time. These both will lead to an increase in the production of stress hormones like cortisol, which is what will happen when stress goes on for a long period of time. High level of cortisol over a long period of time, which is what is seen in chronic stress, will lead to an impairment of the hormones that are needed for the production of sperm cells. So being overweight and the male partner being stressed over a long period of time will lead to low sperm count. Heat is an absolute no-no. Your testicles do not tolerate high temperature in your scrotal area. The source of high temperatures comes from saunas, hot tubs, and wearing tight clothes that leads to the testicles being held closer to the body, and that will increase the temperature in the scrotum. And what that will lead to is a significant slowdown in the production of sperm cells. And when men expose their scrotal areas to these high temperatures frequently by wearing tight trousers, tight underwears frequently, these men will have lower sperm counts.